that. Well, you might have noticed a lot of pink in the studio today. October, of course, Breast Cancer Month. A new report, though, released just yesterday, finding the number of women dying from the disease has dropped significantly over the past 35 years. But guidelines continually change, and we want to make sure that you are staying healthy and staying informed. Dr. Sonal Haerter with Dignity Health is here to talk stats and the new recommendations. Dr. Haerter, thank you for coming in.
Absolutely.
We certainly appreciate it. So let's talk first about screenings for women. They can vary by age and time frame. So what's changed?
Correct. So basically, these recommendations for average risk women, not for high risk women. And there are two forces, American Cancer Society and United States Preventive Services Task Force. Little bit of differences, but everybody and experts agree that screening should start at the age of 40 annually until the age of 75. Now, 75 and over, if you have a healthy patient, a healthy woman with a 10-year survival, they need to continue with those screenings as well. Okay. So those are basically recommendations for healthy average risk women.
Certainly. And when we talk about the new recommendations, we also need to be considering the dense breasts. That can play a factor as well.
Correct. And Rachel, you're so right. The recommendations for that have changed in September of this year. And what FDA recommends is mammography facilities are now mandated to report on density. Why? Because the more dense your breast tissue is, your risk for breast cancer is high, as well as cancer can hide in these dense breast tissue. So if you have grade 4 or D, as we call dense breast tissue, you may need additional imaging besides just a screening mammogram.
And something we talked about, I know we say that 40 is the age you need to start considering doing it annually, but if you're doing those self-examinations at home, which you should be doing, you can ask your OBGYN about doing that. Can you push to get an MRI or a mammogram?
So if you have high risk, and what is a high risk? If you have family members, first-degree relatives, if you have self-history of breast cancer, or if you're positive for certain genetics like BRCA1 or 2, then you definitely need to consider screening earlier than 40. And this is a conversation. We were just talking about doing a breast cancer risk assessment tool for all women to know what the risk is.
I know the women here in the studio said send it to us via email. Yes. We want to fill that out, and if you're less than 20%, it's okay, but just make sure that you're taking the steps to make sure you're protecting yourself. Now, let's also talk about breast cancer among men, because some people don't understand that that is very applicable.
Correct. Although the risk is less, so about 500 men die from breast cancer each year, as opposed to over 42,000 for women. So we don't have screening recommendations for average risk men, but high risk men, yes. So who are high risk? Again, family history of ovarian cancer, breast cancer in first degree relatives, somebody who is having symptoms or somebody who's positive for certain genetics need to consider screening, including imaging and exam from their doctor.
Absolutely. And like most, cancers, there's risk factors involved, and a lot of them are stuff that we hear all the time, but let's talk about some of the risk factors and what we can be doing to stay healthy now.
So here's what I want all our audience to know is about 5 to 10% is hereditary, meaning 85% actually have no family history. And this is a common myth I hear in my practice that I don't have family history. 85% cancers happen in someone who does not have family history.
Yeah, you're the start of that unfortunate hereditary
Correct.
Yes.
And some other risk factors are sedentary lifestyle, obesity, excessive alcohol use, smoking. As we get older, the risk goes up. And being a gender, like female gender itself is a higher risk. Radiation to your chest, and so many others, but these are the main ones.
Absolutely. And I know, October, obviously we talk about it more and more, but it is something that people should be mindful of 365 days a year.
Absolutely.
And I know you're here today on behalf of two of your dear friends. Thank you. I know it's a topic close to your heart, so thank you for being here. And tell us about the fuzz briefly, just about Jen.
So one of my girlfriends who actually passed away from breast cancer, diagnosed under the age of 40, no family history. She loved four. So this is
a nod to her.
Yes.
Well, thank you for sharing that with us, doctor, and thank you for all the great advice. Troy will send it over to you.